Now, let us see some images. This is nucleated parakeratosis of stratum corneum. This shows basal cell carcinoma of the skin, rolled over edges. This is squamous cell carcinoma, cauliflower-like mass. This is zinc cell in the zinc smear or acantholytic cell. Subcorneal blister, suprabasal blister, spongiosis, which is intercellular edema, Darier's disease, hyperkeratotic papules in seborrheic areas. This is acne stage 2, comedones present. Acne stage 3, papules. Acne stage 4, nodules and cysts. This is hormonal acne, hirsutism present with acne. These are some extra images. Hidradenitis suppurativa. It is the axillary comedones and papules. Hidradenitis suppurativa of the axilla, discharging nodules and sinuses seen. Again in axillary region, papules seen, which is known as Fox-Fordyce disease. This is Fordyce spots on the upper lip, yellowish in color. See, this is melasma and this is SLE malarash. Drugs causing SLE can be remembered by the mnemonic SHIP, which is sulfonamide, hydralazine, isoniazid, and procainamide. This causes SLE-like lesions. This is telangiectasia. This is rosacea, rhinophyma, acanthosis nigricans. This is androgenetic alopecia in male, vertex baldness, and in female, central scalp baldness. Albinism, nevus depigmentosus. This is vitiligo. These are different types of vitiligo: segmental, universal, etc. This is bindi leukoderma due to PTBA. This is nevus of Ota, which is bluish discoloration around eyes with scleral pigmentation. This is dermal bluish pigment with scleral pigment, again nevus of Ota. This is Mongolian spot. It is congenital. These all are congenital. Beckers nevus is also congenital. It is superficial spreading melanoma. This is wheal present in urticaria. Dermographism, angioedema. These all are histamine-related disorders. Urticaria is one of them. This is urticaria pigmentosa. Now let us see some shapes of the skin lesion. This here is annular or ring-shaped. These are present in lesions like dermatophyte, impetigo, syphilis, leprosy. Here there is central clearing. This is Koebner's phenomenon in which there is lesions over the trauma line. See this Koebner's in psoriasis. This is Koebner's in lichen planus. These are the target lesions. This is Wood's lamp with wavelength of 365 nanometer. This is the observation in the Wood's lamp in tinea capitis. This is erythema. It appears coral red on Wood's lamp. This is Wood's lamp in pityriasis versicolor. This is Osgood sign, which is multiple pinpoint bleeding observed on scraping the scales in psoriasis. This it is known as Greatage test. Now some histoimages. In psoriasis, suprapapillary thinning, papilla going until stratum corneum. Parakeratosis seen, which is nuclei in stratum corneum, and spongiform pustule seen. Fishnet or intracellular pattern. This is linear. This is neurofibroma. Cafe-au-lait macules is seen in neurofibromatosis. Ashleigh macule seen in tuberous sclerosis. Sjagren's patch again seen in tuberous sclerosis. These are all genodermatosis disorders. Adenoma sebaceum. This is Conant's tumor seen in tuberous sclerosis. Now let us see some nail diseases. In psoriasis, nail pitting is seen, which is regular. Nail pitting with psoriasis or nail folds. Oil drop sign seen. This is thin nail in lichen planus. Pterygium seen in lichen planus. In chronic renal failure, half is brown and half is white. Half and half nail is thin. Now neutrophilic dermatosis. Pyoderma gangrenosum. It is painful ulcer on the lower leg with violaceous margin. This is Sweet syndrome. Painful erythematous plaques on extremities with fever. This is Behçet's disease. Here painful recurrent aphthous ulcer can be seen like this aphthous ulcer with red halo in Behçet's disease. In Behçet's disease, oral ulcers can be seen, uveitis and pathogy test positive. It is seen in Crohn's and ulcerative colitis, which are inflammatory bowel diseases associated with it. This pyoderma gangrenosum is a misnomer. It is not gangrene, it is neutrophilic dermatosis, which is also known as Sweet syndrome. Now this is cutaneous TB. This is lupus vulgaris. Carrying in center and progression at the periphery. This is crofulloderma, draining sinuses. Erythema nodosum. Reactive arthritis. Ursinate balanitis. Keratoderma balanovesicum. DLE, here Trophic plaque with hyperpigmented borders is seen. Here, carpet track sign or thin texine or cat's tongue sign is seen. It means hyperkeratosis and plugging of the follicular ostia with keratotic material. This is alopecia areata. Exclamation hair. This is broad upper end of the hair shaft. Point of attachment on the skin is narrow. Alopecia areata again. This is trichotillomania. Lichen nitidus on the extremities and on the penis. Hansen's disease, which is leprosy. In tuberculous tuberoid type, single well-defined hypopigmented patch with anesthesia and loss of sweating is seen. Here, single well-defined annular plaque with anesthesia and loss of sweating with type 1 lepra reaction. In borderline type, punched out center is seen. Numerous hypopigmented, hypoethic patches both sides of midline are seen. This is trophic ulcers and lepromatous type. Leg of thymus, bilateral. These are leonine faces in leprosy, histoid leprosy. Earlobe infiltration, like this is seen. Painful nodules seen. This is MDT pack. Grains zone. Histology. Slit skin smear. Now let us see some STDs. This is syphilis, single painless indurated hard ulcer. Dark brown immunofluorescence. Triponema pallidum seen. Secondary syphilis, mucus patches seen. Papillosquamous lesions on palms and soles in secondary syphilis. Moth-eaten alopecia, non-scarring alopecia seen. Chancroid, which is soft chancre with bubo. This is ipsilateral bubo. Kissing ulcers due to autoinoculation. Smear of the gram stain. Here, railroad track or school of fish is seen. Donovanosis, bleeding, granulating ulcer seen. Closed safety pin arrangement seen on staining. In LGV, bilateral bubo seen. This is groove sign. These are genital warts. This is herpes genitalis, which is grouped recurrent vesicles. Gonorrhea, purulent thick urethral discharge. In vaginal candidiasis, white thick curdy discharge seen. Flu cells in bacterial vaginosis. Herpes genitalis. These are the syndromic kits. These are explained in detail in STI video. Now let us see some psoriasis pictures. This is Koebner's phenomenon, silver scales, chronic plague. This is psoriasis vulgaris on the extensor surface. This is sebopsoriasis, pustular psoriasis. Von Zombisch psoriasis. Gutted psoriasis, here smaller lesions are seen, raindrop-like. Erythrodermic psoriasis, which is the more than 90% involvement of the body surface area. Now some images of lichen planus, typical violaceous lesions, Wickham stria, white lacy oral lesions, band of lymphocytes at dermoepidermal junction. Now let us see some fungal images, fungal infection images. This is of Pityriasis versicolor. Here multiple patches with fine scaling is seen. In Pityriasis versicolor, both hypo and hyperpigmented are seen. This is hyperpigmented variant and this is hypopigmented variant. Spaghetti and meatball appearance seen on staining. This is the picture of oral candidiasis. This is candidal belanophthisis, candidal intertrigo with satellites, not so important. Annular lesions in tinea. This is athlete's foot because of tinea pedis. Onychomycosis, tinea unguium, tinea capitis, grey patch, black dot. This is sporotrichosis. Asteroid bodies seen. Mycetoma, swollen foot with sinuses. Now let us see some viral infection images. These are the group blisters of herpes labialis, dewdrop on rose petal, herpes zoster, herald patch, periangual warts. These are multiple warts. This is molluscum contagiosum. These are the burrows in the scabies, like this. Again, scabies. Vein burrows in the scabies. This is nodular scabies. Norwegian scabies. Head louse and knit. Pubic or crab louse. Macula caerulea. This is erythema chronicum migrans. Insect bite hypersensitivity. Now let us see some images of eczema. Atopic dermatitis on cheeks in a child. On the most common site, which is cubital fossa in adults. Pityriasis alba on cheeks in a child. Denny Morgan folds. Irritant contact dermatitis. Again, allergic contact dermatitis. Patch test. This is the result of patch test. Ideally, patch test is best seen after 4 days, but we can also see hypersensitivity reaction after 2 days. Parthenium plant. Now let us see some drug eruptions. This is hyperpigmentation after fixed drug eruption. Again, same. These are target lesions, erythema multiforme. Again, target lesion. This is hemorrhagic crust seen in TN sheath-like epidermal detachment. Now let us see some blistering disorders. Bullous impetigo. Pemphigus vulgaris erosions after rupturing of flaccid blisters. oral erosions, cauliflower-like lesions, pemphigus vegetans, antiflexors, Nikolsky sign positive, bullous pemphigoid, hemorrhagic tense blisters on urticarial skin. This is Hailey-Hailey disease, painful erosions and fissures in axilla, foul-smelling pus and erosions in axilla. This is dermatitis herpetiformis, excoriations, blisters and neutrophil at the papillary tip, blisters at sites of trauma. This is epidermolysis bullosa in an infant. This is epidermolysis bullosa and dystrophica in infant. This is epidermolysis bullosa, dystrophica, mitten foot. Now let us see some erythemas separately. See, this is erythema nodosum. It is due to panniculitis, which is inflammation of the fat. So it is tender, usually non-pruritic, seen in infections like TB, streptococcus, autoimmune include sarcoidosis, inflammatory bowel disease, and Behçet's, pregnancy, drugs like sulfa drugs, penicillin, and OCPs. Next is erythema induratum of Bayesian. It is cutaneous TB ulcerates, presents posteriorly, and it is a type of hypersensitivity reaction. Erythema multiforme, target or bull's eye lesion, seen in simplex, herpes simplex, or mycoplasma, in drugs like sulfa drugs, chloroquine, and NSAIDs, seen in some malignancy and can involve mucous membrane, and Cobnus phenomenon is present. Next is erythema marginatum. It is seen with acute rheumatic fever. It is non-pruritic, evanescent, which is suddenly appears and disappears and worsens with heat. Next is erythema marginatum hemorrhagicum. It is due to sorafenib, which is a type of drug. Erythema migrans, target lesion, seen at the site of tick bite. Drug of choice is doxycycline. Next is erythema gyratum ripens. It is a paraneoplastic associated with internal malignancy like lung, most common, and breast. Next is erythema antibody ignis. It is due to heat application like infrared exposures of laptops on our stomach, hot water bottle, etc. Erythema neonatorum toxicum. It is benign and self-resolving. No need to worry in this. It is a misnomer as its name is toxicum, but it is not toxic. It resolves on its own. Now, next is erythema infectious. It is fifth disease and it is caused by parvovirus B19. Thank you.